One thing about Zika is that it is a new disease in the sense that it has arisen very recently, and there are many things that we don't know about it yet. And that's something that we have to accept, but also see as an opportunity to investigate new things, to try and find out more about the disease so that we can control it better. One of the things when it comes to vectors is, and there's been a bit of controversy over whether other species might be vectoring the disease. So we know Aedes are important vectors, but it could be that other species are vectoring Zika as well, for example, Culex mosquitoes. And there's been a bit of discussion around that topic quite recently. And some studies are being done to try and define whether Culex are involved in the transmission, but at the moment we don't know whether that is the case, and more studies are certainly needed. Another thing that we need to know about is how do we determine the risk of Zika in communities? By using entomology, by using potential indicators. So for example, vector density, how many mosquitoes are there, by looking at the larvae or by looking at adult mosquitoes, and also by looking at the infection rates in those mosquitoes as well to determine what the risk of infection is within a particular community. Those have been well defined for certain diseases like dengue, and we know more about dengue and malaria and other diseases like that. But for Zika, again, there's a lot of unknowns, and we need to define those parameters so that we can better assess the risk of Zika in the countries that have the disease at the moment. Now we know that humans obviously get Zika, but we also know that animals can harbour the disease as well. And these are called reservoir hosts. And it's very important that we understand which animals may be harbouring the disease. For example, we know that primates are important. And in South America and in other parts of the world, you have a big overlap between human populations and animal populations. So we need to understand more about which animals might also be harbouring the disease as reservoir hosts, and therefore having an impact on the transmission of the disease. Another thing that we don't quite understand about the Zika virus is whether it can be transmitted transvarially. So whether it can be transmitted from the mother, from the female mosquito, to the eggs, and then the eggs hatch out and the young mosquito larvae and then the adults that they emerge into have the disease as well. This is possible for other types of viruses. We don't know whether it's possible for Zika at the moment, and that's something that needs to be investigated further. Now, when it comes to vector control itself, again, there are many unknowns, and we're in a position where we have done many years of vector control on many diseases, yet we really do lack good evidence, and that's usually because the studies that have been done have not been done to a particularly high standard or got the right data to be able to allow us to make good recommendations. So going forward, when we're doing these intervention trials, when we're looking at vector control, we need to design these studies properly. What we need are large randomized control trials using the technologies. Some of these technologies will be old technologies that we might think are of no use, but actually might be if we investigate them in the right way, or combined with other technologies. And some of these technologies will be new technologies like GM mosquitoes or Wolbachia, for example. So we need to generate the evidence to be able to make the right recommendations. But it is a bit of a tricky area really, because some people are of the mind that we should just go with what we think is the right thing and roll it out. Why are we wasting time generating data? But on the other side, it is important that we have the data, the right evidence to be able to make the right recommendation without making mistakes that we might see further down the line. But how much data you need is a big question. And that is something that we as scientists need to tackle, and we need to be able to generate the right data to be able to make the right recommendations.
There is a number of cohorts being conducted now, and there are essentially two types of cohorts of pregnant women. One is cohort of pregnant women who already have a rash. So we identify them at the rash, we test them to see if it's Zika, and then we follow them up. There's already been there's some studies already reporting. There was a preliminary study in the New England. We followed 40 women and estimate 29% risk of congenital Zika syndrome, so it's very high. But there are many other studies, and it's important that there are many different studies because we need to find out if the risk is the same or if there are cofactors. For example, previous dengue might change the risk of congenital Zika syndrome. So the cohorts are very important. And so there are cohorts of pregnant women with rash, but then there are also cohorts of pregnant women without rash. So women who are followed during the whole antenatal care and tested every month or so to see seroconversion. And those cohorts will look at the risk of congenital Zika in women who have Zika infection, but not clinical infection during pregnancy. And that's an important question. Whereas the clinical symptoms are important for congenital Zika syndrome or not, because that has major implications for how you manage this during antenatal care. So the cohorts will also provide information on the spectrum of the syndrome, and they will also provide information on how early can you detect microcephaly. So it's doing repeat ultrasounds, and then identify babies with congenital Zika syndrome, and looking back in the ultrasound and identify what aspects in the ultrasound can be detected and how soon. And that again will be important for personal choice more than almost anything. And I think the next set of important questions are about impact of congenital Zika syndrome in countries where it has been present. I think aspects that need to be looked at are impact on the families. So impact of pregnancies, even before they have Zika, how do women feel about pregnancy at the moment? And just personal experience in Brazil, before the epidemic, you look at pregnant women and you so feel benevolent and happy for them. And during the epidemic, you see a pregnant woman and you feel worried about, is this baby going to be normal? So I think the experience of being pregnant during an epidemic of congenital disease like that is very, very different. So trying to understand how that impacting the experience of the woman, just being pregnant during the epidemic, a diagnosis of Zika infection during pregnancy, and then very important, the impact of having a baby with microcephaly or mild forms of congenital Zika syndrome. Again, just observation of a few cases, the impact can be very, very severe. Marriages break up, almost all women we talked to lost their jobs because caring for a severely disabled child is a full-time job. A sense of bereavement, a sense of disappointment, of loss, and trying to cope with children can be very difficult. Many children are very irritable, cry 24 hours a day, so parents barely can sleep. So there are very major impacts on the life of the women and the family, and I think it's very important to document that. And then the second aspect is the burden of on the health services. These are children that need to be seen by doctors, and they need to have their neurological manifestations controlled and monitored. And then they will have disabilities, hearing and sight, cognitive performance. Would they be able to be cared for at home? Would they need institutional care? So there's a whole issue of impacting the health services. Of caring for the children, there's also the impact of just having to diagnose all these kids. So there's the whole impact on the health services, and then just the cost to the family, the cost to health services, the cost to society of having so many the parents leaving work, for example, decreases productivity. So there's a large issue of understanding the impact, and I think that's a very important new epidemiological question.